Let's talk surfing. So there's three injuries we're going to discuss: fractures, mild traumatic brain injuries, and shoulder burn. Surfing as a sport. There's two main divisions of surfing: competitive and non-competitive. However, all three of these injuries are relevant in both scenes. Surfing is growing. If you look at the last few decades, the number of surfers are significantly increasing. That means there's new people coming in who aren't necessarily educated about the risks. More research is coming out. In the last decade, you've had more medical research on surfing than in the last four combined. And it's important that this information gets spread to the general population and surfers. And then there's a lot of misconceptions out there about surfing and the sources of danger. A lot of people think marine life is a huge threat, rocks and rip currents. However, that's not necessarily the case. The most common threat to surfers is actually their own board. And you'll see in the next few minutes of this presentation how prevalent board injuries really are. Dangers of surfing. Big wave and small wave surfing. Big wave surfing is defined as surfing 20-foot plus waves. And as you can guess, that is just simply more dangerous than surfing smaller waves, which the most people do end up surfing smaller waves, which are usually around 6 feet. And then, like I said before, only about 6% of injuries come from marine life. And it's just a misconception that they're the primary danger to surfers. And surprisingly, surfing has a very low mortality rate, with it being only about 10 deaths per year. And compared to other sports, that's very low. The most prominent injuries we see in surfing is face and chest fractures, concussions or mild traumatic brain injuries, and shoulder burn. Face and chest fractures. What is a fracture? There's two types of fractures, right? An incomplete fracture and a complete fracture. An incomplete fracture, you can kind of think about it as a crack in the bone, and a complete fracture is almost a full separation of the bone. 11% of surfers suffer from some sort of fracture in their career. 30% of those fractures are to the face, and 23% of those fractures are to the chest. And the biggest threat with a fracture is the threat of drowning. Either you can't paddle back in due to the severity of your fracture, or you might even lose consciousness if it's a face fracture. And that's very dangerous when you're in the ocean, especially when there's 6 to 8 foot waves coming in. How does that happen? Most commonly, board to body contact. Like I was saying earlier, your board is your biggest danger when surfing. If you see this board, it's in the wave. That force of the waves combined with the hardness of the board, if that contacts the face or chest, that's enough to cause a fracture. And the biggest issue is a lot of people make contact with the board when they're swimming back up. When they're swimming up, the board hits them, and then that's where the fracture comes from. The only real way to prevent this is head coverage method. It's similar to this. You put your head over, and then you point your elbows up. I'm a bit restricted by my attire, but it's something like this. And you could use foam boards. I recommend that for newer surfers, because at that point, your type of board really doesn't matter. And the foam boards are just softer and give you a little less threat. And the biggest issue is if you hit your fins, which is unavoidable in any type of board. And I only say for beginners, because generally more experienced surfers use fiberglass boards, which are always just very hard, and it's just unavoidable to get around using those. Concussions and mild traumatic brain injuries. If you compare it to the last couple of decades, the percentage of concussions / mild traumatic brain injuries hasn't moved really. It's been consistent over the decade, meaning this problem is not going anywhere, and it really needs to be addressed. So the biggest issue with these head injuries is going to be loss of consciousness. If you get hit hard enough and you go unconscious, you very well could drown, and that's a serious threat to a surfer. How does that happen? Board to head contact. Again, board to head contact is a surfer's biggest threat. And even big waves / roll waves can cause a concussion if they come in contact hard enough with the head, or it's definitely a threat. Rogue waves are going to be more seen in small sets, like in 6 to 8 foot waves. You might get a swell where you see a 12-foot wave come in and you might not catch it, and if that hits you hard enough, again, you can get a mild traumatic brain injury. Something that a lot of surfers don't consider is how surfer dense the area is. If there's a lot of boards in the water, that's just a lot more possible hazards for you and possible things to hit your head on. Again, the prevention head coverage strategy. Using this movement right here can save a lot of pain for a lot of surfers, and not everyone knows about it. And then if you see big wave surfers, sometimes they have a CO2 life jacket, like the one you see in this picture here, 2 canisters, and then a pull cord. So if they see a big wave coming in that might push them deep into the water, or they think it might cause a head injury, they can pull that cord to keep them afloat to avoid drowning. And then small waves, you'll see a lighter weight life jacket similar to a wake vest that will just help keep them up by the surface level in case they lose consciousness, and or if they get pushed, it prevents them from getting pushed too deep. Shoulder burn. So supraspinatus tendonitis, or is an overuse injury. It's not life-threatening, but it's very common with about 200,000 cases a year, and it's a chronic injury. Meaning, if you get it once, the chance of you getting it again is pretty high, and it's definitely not the type of inflammation you want in your shoulder. How does it happen? Deep arm extensions. If you're reaching way out, you have a high chance of pinching that shoulder with your rotator cuff and then rubbing the tendon, which would cause inflammation of that tendon. If repeated enough times. Muscle imbalance can play a role into this as well. If you have an imbalance between your interior rotator cuff and your exterior rotator cuff, it can just increase that chance of pinching that tendon with the shoulder. And again, the way to prevent this really is just by strengthening the infraspinatus muscle. And what that does is it reduces the chance of that pinching. And listen to your body too. If your body's in pain, if it's saying your shoulder's in pain, the best thing to do is get out of the water, assess the shoulder, and see if you need to ice it or take it to a medical professional. Conclusions. Surfing's dangerous. People don't always think it's as dangerous as it is. It may have a low fatality rate, but there's many acute injuries or sudden injuries that can happen. And there's a couple chronic injuries which aren't as big of a threat, but they're not always preventable. And the best thing you can do is reduce your risk. There's no clear shot way to prevent that. And the waves are unpredictable, meaning you can't plan for a big wave to come in. And if that big wave catches you and you don't see it, well, you can have a very severe injury that could be life threatening. And then this is a list of references used to support all of these statements. Thank you for listening.